So welcome everybody. This is a webinar. It's the first webinar for iComply application users, and it's going to be the first of a series of webinars which I hope you're going to find useful and helpful. Our goal here at Code is to engage with iComply application users now on a regular basis. On one hand, to keep training you about the application and the updates in application. On the other, to tell you about the latest updates that are happening in dentistry and in compliance. And I think that you're going to find these short webinars very, very helpful when you're working with iComply, so that you understand it and so that you stay up to date. I'm not going to go into any great depth in any subjects, but I will be touching on today patient complaints and how you would review patient complaints in iComply. iComply is a quality management system, and by quality management system, what that means is that we create standards. And our standards in this case are the code, procedures, policies and documentation. These are the standards that we run our iComply system by. So we set the standards, we modify them at the practice level, we train the team on the standards, we carry out audits and risk assessments throughout the year, we see how we're doing with the standards, and then at the end of the year we have an annual management review where we review how we've met the standards, what we've done in the year, how well the team have managed to do their tasks, and we review things like problems, complaints, significant events, we review accidents or things that have gone wrong at the practice, and we review things that have gone well. And by doing that then, we can set the standards again for next year. And that cycle of setting standards, training the team, auditing the standards, and then reviewing them, and then setting new standards for the following year is a cycle of quality assurance. It's based on ISO 9000 principles, so that when we created iComply, even though it just looks like a compliance system, it's more than compliance, it's actually a quality management system. And it brings in quality management without you really knowing it, which is the great thing. It's called clinical governance, or in the new world of the CQC, in the fundamental standards, they call it good governance. So iComply then, it helps you to meet the good governance requirements, as well as leading you through all of the other requirements in dentistry. There are so many different areas of compliance that we need to meet. NHS, Department of Health, the Employment Law, MHRA, the GDC, to name but a few, and of course the CQC in England and Wales. There's just a massive raft of compliance. There's a whole landscape of compliance. But the thing about this landscape is it's continually changing, and the compliance is changing all the time, and the pace of change is increasing so much. So that in order to stay compliant, it's impossible for you as a user, as a dental practice owner or manager, to be fully compliant today, because there are new things coming in all the time. All you can do to meet compliance is to schedule updates of compliance, so that you're checking health and safety, you're checking fire, you're checking infection prevention, you're checking complaints, and so on through the year. And as you check them through the year, you then bring everything up to date to the latest standards of compliance. And this is how we do it in iComply, is that in the old world of the paper systems, we would send our members paper updates, and the paper updates would build into a mountain of compliance tasks to meet. And now what we're doing is we're putting the updates into iComply and automatically telling you to review these areas. Of course, if something comes up that you need to review more urgently, we'll tell you in the news section of iComply, and I'm going to show you this in a few minutes. I know that you will have it, but I'm going to show it to you in a few minutes. So that we schedule for you this continual monitoring and updating. It's a massive landscape of compliance, and there are lots of different ways that you can skin a cat, as we say. There are lots of ways that you can meet the compliance needs of a dental practice. And in Code, we've developed our own way, which you call the code management system, or even the code ecosystem. And the code ecosystem, it includes the iComply application, it includes the code folder set, which is part of a whole management system for quality. We know now that there are new standards there are new fundamental standards coming out in April 2015. And you as iComply application users don't need to worry about the new CQC standards because they'll be in iComply. So this is the iComply workflow. We set our standards and procedures, such as we're going to look at today, complaint problems and significant events. We train the team at a practice meeting. There are 9 practice meetings in iComply. iComply is broken into 9 areas of compliance: health and safety, infection prevention, X-ray safety, and so on. As you set up each area of compliance in an iComply administration step, which we'll look at in a few minutes, you set up all the compliance areas, the policies and procedures, and then later that month you'll train the team at the practice meeting in those policies and procedures, and you have a record of training the team. So on one hand you're setting everything up, on the other hand you're training the team. And then through the year and scheduled in iComply are the required audits and some optional audits and the required risk assessments that you have to carry out when running a dental practice. And these just happen, they're scheduled in your calendar through the year, and they're allocated to the various individuals who are in your iComply team. Then at the end of the year, you have the annual management review. We call it Team Meeting 2, iComply Team Meeting 2. There are 2 iComply team meetings. The first iComply team meeting at the beginning of the year is when the team who are working on iComply get together and plan it. The second iComply team meeting is at the end of the year, when the same team get together and they review all the things that have happened in the year, including the compliance report that you can print off from iComply. So that's our clinical governance workflow. To meet Regulation 17 of the new fundamental standards, Good Governance. It's for continuous improvement. So this is how it works, this is what we do. Your iComply activities are scheduled on the calendar through the year. Within each activity, you'll download the templates, the policies and procedures, the risk assessments and the audits, or the practice meeting agendas, and you'll work on them as necessary. And then you can file in the iComply folder system, which I'm sure many of you have, the evidence that you have, or your policies and procedures, which are there then handy for the staff to refer to, but also handy for the CQC inspector. Note that we never file anything confidential in these folders. For example, we don't file patient complaint details in these folders. We only file the patient complaint templates. Because they're publicly folders, they're just out on the shelf in the office, in the practice, where all the team can access them and refer to them. And if you have an inspection, you can show the inspector these folders, and if the team member is asked about a policy or a procedure, they'll know where to look in these folders. So it's very nice to have them set up if you don't have them set up already. And then again we go back to the beginning of the year and we start again with the next cycle of iComply, and then you start to review the standards that you set up in the previous year. You'll all be adding duty of candour and the fitness of persons directors requirements into iComply. That'll happen automatically for you. And that's how you build and maintain the quality management system. So I'm going to now go to the iComply application, and I want to talk about the activity that we're going to review, which will be the activity on patient complaints. It's called, actually the module is called Problems, Complaints and Significant Events. We brought those things together. It'd be quite nice to talk about it. Just to mention that this complaints procedure and policy was completely updated recently when the GDC brought out new guidelines in January this year, January 2014. We completely updated these modules. They've recently been slightly changed because of the new CQC regulations, but the main update was then, and I hope that you're all using the latest modules by now. If not, then it's worth looking at. It's scheduled in your iComply anyway, in your cycle at some point, depending upon when your cycle starts. Now you can see the dashboard, and this is a new section at the top of the dashboard, and in this new section you need to keep an eye on it. It'll change from time to time, and it'll tell you if there are any activities that you need to undertake. So the updated and new modules section. Some iComply application users aren't sure about this, and in fact mostly you don't really need to do anything about these modules, because all of these updated and new modules will be automatically scheduled into activities throughout the year. So this section, you can look at it, but mostly you can just dismiss them. But it's worth just having to think about, do you need to review these before you dismiss them? Because perhaps you reviewed it recently and it's changed, and you might want to just see what's changed in it. So mostly, as an iComply application user, you don't need to do much about the updated and new modules section. It's just there for your information. And you can just go here and dismiss them all at once. You click dismiss multiple, choose the ones you want to dismiss, and then mark as reviewed, and they will disappear off your list. So keep an eye on them, but then don't need to do too much about them. We'll tell you up here if you need to do anything. So if there's a module down here that you've got to do something with, you'll see it in the news section. So that's where you should look. Keep an eye on it. And remember, view all will take you to previous news. There's not much previous news in this because it's the latest version of iComply. It's phase 2, so we don't have any old news in it. Here's some to-dos which are on my list. They're just sample to-dos. You might just want to check you haven't got any to-dos that need to be done that you haven't done. And then, of course, here you've got activities due this week and activities that are overdue. This will start to populate now. It's also new from this particular phase 2 version. So something to keep an eye on. So that's the dashboard. It's been slightly updated. It's worth looking at. You should really, whoever's in charge of iComply should look at the dashboard every day, the administrator. And of course you can check on the team members, and I'll show you that in a few minutes if I get time. So what I want to do today then is, I want to look at one activity, which is the activity on complaints, on patient complaints. And we'll completely review the activity together so you see that how I would do it. So I'm going to find that activity on my calendar by searching. So I click on search. I'm going to search the calendar for activities, and I have to type actually complaints. Notice this is actually something that's not working as well as it's going to work. If I type complaint, nothing's coming up on my search box. If I type complaints, then I'm getting the complaints, patient complaints procedure activity. It should come up when I type complaint, and it will soon, now that I've noticed this error. So I'm now searching the calendar for activities. I click on that, and it'll take me straight to the activity. And this is my activity on the patient's complaints procedure. Now, in this version of iComply, we've added quite a bit of extra activity description at the top. And it says here, it's a GC requirement to manage complaints properly, you have an open culture, and so on. So there's some very interesting information about patient complaints in there. So always when you're doing an activity, always read your activity description before you do it. Just to show you where this activity is sitting, by the way, it's in an administration step. And this administration step is on care standards. And this administration step has all of these compliance reviews in it. Treatment planning, meeting nutritional needs, prevention and public health, hygienist and therapist prescribing, and so on. Of course, patient complaints is there somewhere. Where is it? Patient complaints procedure is there. So, administration step have a number of compliance reviews in it. This patient complaints compliance review we're looking at now, patient complaints procedure, and I can see that this is actually the responsibility of a team member called Jill Cox. As you know, we set the team responsibilities for the areas, the compliance areas here, and then when we create the cycle, it allocates the activities to those team members. So Jill has been allocated this patient complaints procedure, but I'm going to be doing it, aren't I? So I'll call myself Paul Thompson for the sake of it, and I'm going to do it today, actually. It says the due date is then, doesn't matter when the due date is, because I'm going to complete it today. So what do I do to this patient complaints activity to complete it? Well, the first thing is, I need to look at the related templates. So I click on here, and I can see that I have these related templates for patient complaints procedure. I've got the overview document, patient complaints, problems, complaints and significant events. I've got the event record, the event register, the patient's complaints procedure, and the patient's complaints policy. And note, this is a new feature in iComply. It tells you here which folder they should be filed in. All the policies are, for example, filed in the staff handbook, which is iComply folder 7, whereas the rest of these procedures are filed in folder 6. So What I would do then is, I'm about to do this patient's complaints activity, and I'm about to review patient's complaint procedure. So first of all, I look at the overview document. And this is the overview document of patient complaints, problems and significant events. It tells you about patient complaint management, and it gives you some overviews, and then it gives you a letter, an initial letter for a patient's complaint. So this is the overview document on patient complaints. So you would start off by reading the overview document. All code documents are in the same format. We have an overview document, usually has a number G110, G110, and then the documents that are related to it will be A, B, C and D. So that's the overview document. If I go back to my templates in iComply, I then have what's called an event record. Let's look at the event record. Now this is a record that we make for every complaint, every significant event. And it's a very simple record. We write about the event detail, what it was. So it could be a complaint or supplier problem, it could be a spillage, it could be a significant event. We say who's involved and the actions taken. It's our overview record. Now this record has to be filed confidentially, but we recommend that you file all of these records together in a patient complaints folder that is kept in a locked file. And you would file this record with any correspondence about this patient's complaint, and perhaps even a copy of the patient's own records if you're not computerized. Any letters that you write to the patients, any letters that you get back, and so on. So that's called an event record, and we use that as our overview record. But to go with the record, I then would use a register. Now the register is very important, especially with the new fundamental standards, because in the register, what we do is we write down, we give each record a number, and we write down the record number, the type of event, patient complaint, who's involved, Paul Mendelsohn, who's dealing with it, Paul Mendelsohn, and or it might be my practice manager, and so on. And this is a really good way, because with the event register, you're managing your problems, your complaints, and you're making sure that they don't last a long time, that they're being resolved. So it's very important to have an event record and an event register. And the CQC may ask you for a copy of this, and in fact in our new annual management review, we produce a report each year of our patients' complaints, how we've dealt with them, what's happened, and how we've improved the service because of them. It's all part of the requirements. So you maintain the register. And then we have a procedure, which is very important. And this is for the patients to see, because we talk to our patients and we say, we have a patient complaints procedure, and we can have this available for them. And this is the procedure. I'll just show you the beginning of it. It's our aim to always have satisfied patients and to meet standards of care and service. And then we talk about the complaint. If you're not entirely satisfied, please let us know. We'll respond within 3 working days, and we'll try and provide a full response within 10 working days, and so on. And that's the actual procedure. And then it has some very important information that you must give to patients. If you're not happy after our procedure, you can make a complaint to the Commissioner of NHS Services. If not happy with that, you can go to the Ombudsman, and so on. All important information. This is our patient-focused procedure. But we also have a policy. Now the patient complaints policy goes with our other policies, and we file it in folder 7, and this is the policy. And this is one of our many, we have over 100 policies in code. We always produce policies when we feel that we need to. We don't just produce policies because we want to, we produce them because either there's a requirement for it, or many of our members have asked for it. We don't just produce policies ad nauseum. So if there's a policy there, pretty much you need it. We're the same with all code information. We never produce it unless you really need it. So then we've had then these documents. I'll just dismiss the documents now. So here then are the related documents for patients' complaints and significant events. So what I'll do then, I will download these documents to my computer, and I'll review them to make sure that they fit what we do in our practice. We might want to put our practice logo in there, or our practice name in there as well, to personalise them, which is always a good thing to do. When I'm happy that I've got these policies and procedures correct, updated using the latest templates, I will then do two things. I will prepare to file them in the iComply folders where they should be filed on paper, but we can do it digitally if you prefer digital. And I'll prepare for the practice meeting which is coming. Now if I just go back to the step, let's say that I've now downloaded all the templates, I have updated them, I've modified them as I need to, and I've saved them. I could say I've saved them in a Dropbox, for example. We recommend Dropbox, it's a very great way to save our documents. I've now done my activity on patient complaints. So, I'm going to now close this activity because I've completed it. So I'll say, any needed templates have been downloaded and reviewed. Templates have been adapted and adopted as necessary. And then the actions arising from the templates have been carried out. So I've done all of those things. And what evidence do I have? Well, I have the documents and policy. I'm going to say filed in Dropbox for now, and the folders, because I'm filing it digitally in Dropbox for security, but I'm also printing it off for the folders because it's great to have. And in the folders. And what I can do now is, I can add links. I can't do it because I haven't got any links handy. But if I have my Dropbox links, I can click here and I can say patient complaint procedure, give it a title. And I can put the link in here, which is my Dropbox link to that procedure. I just copy it from Dropbox. So I'm going to pretend worldwideweb.dropbox.com. You just copy and paste it normally, but I'm just making something up. /test.doc. Okay, so as if that was a Dropbox link, copied and pasted. I add that link. And now you can see down here, I've got links to evidence for this procedure saved in the activity. If I click on it, it'll go straight to that link, which is a fake link. It's not going to work, but that's how you save the links in iComply to documents on a cloud service such as Dropbox. I then mark as complete. I can just save changes and come back to it later, or I can complete this activity, which I'm going to do. So when you mark it as complete, you get a little box. You can add some additional information if you want to. I don't usually, as it happens. Who's completed it? It's Paul Thompson. That's me for today and this particular activity. And I mark it as complete. And now you can see the activity has now been completed by Paul Thompson today. So that's how I've now downloaded these documents on patient complaints. I've reviewed them. I've made sure they fit our procedures. I've filed them digitally and in paper form, and I've marked this activity as complete. And if I go back to my activity on care standards, you'll see that the patient complaints one has been greyed out. So that's how I review an activity in patient complaints. And if I just go back to the calendar for a moment, it's a meeting on care standards. Our patient's complaints procedure was in there. You'll see that we have a practice meeting. Sorry, this is the administration step on care standards. Patient complaints is in this administration step. And I'll be training my team on it at a practice meeting in a couple of weeks. So what I should do is, for the important things in this administration step, I might want to give a printout of the documents to the team members and say, can you read these policy, the patient's complaint policy, before the meeting? And then when we discuss it, you'll understand it, because they need to know it, don't they? And you will be discussing it at the meeting. And that's how iComply works. You have an administration step at the beginning of the month, towards the beginning, and you have a practice meeting on the same subject at the end of the month. And the agenda is in the practice meeting with the administration step.